This week on Jersey Matters, great news. Hospitalizations from COVID-19 are way down in New Jersey. We'll talk with Cathy Bennett, President and CEO of the New Jersey Hospital Association. We'll take you to a packed school board meeting in Randolph Township to make certain the board members put the names of holidays back on the school calendar. An offshore wind power farm with 100 turbines is planned for the Jersey Shore. We'll talk with the woman leading an effort to stop it. And post-pandemic summer camps are open for business. Welcome to Jersey Matters. I'm Larry Menti. Let's get right to the great news about New Jersey COVID-19 hospitalizations. Here's my interview with Cathy Bennett, President and CEO of the New Jersey Hospital Association. Thanks so much for joining us. It's been rare during the pandemic that we're able to bring good news, but because the association keeps track of this kind of thing, you have some great news about hospitalizations, right?
That's right. New Jersey hospitals are seeing the lowest number of COVID-related hospitalizations since we began collecting data at the start of the pandemic in March of 2020.
Well, give me a comparison. Where were we at the peak and where are we now?
So now we're in the low 300s for hospitalizations. By comparison, at our peak, we were at almost 8,300 hospitalizations back in late April.
And does that keep trending down when you look at the charts? Is it just coming down and further down?
It is. This is the first time we've seen a low point like this since September of 2020.
But what I'm asking is, I understand what the high is and I understand what the low is, but do we keep going down? Like, what was it last week and what is it this week?
Yeah, our trend continues to decrease. Last week, we were in the high 300s. The week before that, we were touching in the low 400s. So we have seen a progressive downward trend on hospitalizations over the past month and a half.
It's obvious, I think, to everyone what it means, but I'd like you to say it. What does that mean for all of us?
That means hope for all of us. That means that our patients are being reunited with their families. And it also means that COVID vaccines are working. And we're so proud that our state, we have more than 50% of our population fully vaccinated against COVID-19.
I understand that you mandated your team members, your employees, to get the vaccination. How did that go?
You have that right, Larry. We did mandate the vaccine. And as you know, you reported on this. What is the impact of COVID on the well-being and mental health of, New Jerseyans? As we take a look at it, the vaccine is our pathway to return to normal, to return to work, and to have all of our team members on site by September.
Was there any pushback at all? Because I know that there is some pushback across the country when universities, when restaurants, when businesses have mandated the vaccine. Did you run into any problems?
We've seen some questions arise around it, but like industries everywhere, we're providing both medical and religious exemptions. And outside of that, we had surveyed all of our staff before taking this step to mandate the vaccine. So there was tremendous buy-in, and there's also the understanding that where appropriate, exemptions will be given.
When it comes to the vaccination around the world, there has been some problems. The United States seems to have led the world in getting people vaccinated, but some countries, it's a crisis. For instance, in India, where cases continue to rise, where cases around the globe were going down. You have stepped in and helped India. Could you talk about what you did?
New Jersey was one of the states that was hardest hit by this pandemic. And when it hit New Jersey in March of 2020, we were one of the first states in the country to see COVID numbers like we see today happening in India. And I've got to say that the leadership here at NJHA, together with the leadership of our acute care hospitals, understands that there are no borders when it comes to COVID-19. And Senator Gopal has been a tireless advocate for the hard-hit areas of India. So this partnership between NJHA, its members, and the Vingopal Civic Association is really a natural fit.
Wonderful. One last question. I wanted to, the health emergency is over, and what you've told us about hospitalizations, of course, plays into that. The health emergency probably should be over, but some of the executive orders were extended by the legislature, including the liability protection for healthcare workers. Talk about that, how important that is.
Well, as COVID-19 numbers are improving throughout New Jersey and communities are returning to life, our hospitals are still feeling the impact of the pandemic, and they're working tirelessly to care for the sick. So we now have 4 known variant strains in New Jersey of COVID, and we still have 300 hospitalized COVID patients. So the work here is far from done. And that liability protection, which was afforded in the compromise, is going to help our hospitals continue filling staffing gaps with the out-of-state clinicians who might otherwise be unable to offer their expertise and care. And then it also allows our hospitals who underwent physical improvements to accommodate those increased volumes and to keep patients in individual settings to minimize that spread of infections. It allows those facilities to continue to maintain those changes as we confront the boosters and also these variant strains.
What do you say to people who say they're not going to get the vaccine because of that liability protection, because they don't know what the long-term effects might be? This is what some people in society say, and then they have no recourse if they get very ill because of the vaccine.
So, for those who haven't been vaccinated, if you have a medical or a religious exemption, go ahead and exercise that right. But if you don't have one of those and you have questions about it, have confidence in the science behind the vaccine. Look at the data that was examined by the FDA and by experts before the emergency use authorization was given. And then think back to those dark days last March and April when New Jersey had almost 8,300 patients hospitalized with COVID. Take a look at our death rate from COVID here in this state and nationally, and know that the COVID vaccine is the safest route for you and the safest return for our state to a new normal.
And we'll end with that. Thank you so much for your time.
Cathy Bennett of the New Jersey Hospital Association. Still to come on Jersey Matters, the fight to stop 100 wind turbines from going up off the Jersey Shore. That's next.